Hi students, for BN623 this year, for the preclinical summative assessments, you're required to come into the clinical suite and perform one of three skills which you know. The three skills are initiating a peripheral IV solution and regulating the rate, wound assessment and aseptic dressing, and application of nasal cannula or an oxygen mask. So what I thought I'd do is do a video to illustrate what I would like to see in the preclinical assessment and give you some idea about how to practice the skills. So remember, when you're going to come and do the preclinical summative, we'll be using the assessment form that's in your formative assessment and your summative assessment book, and the competency criteria are really what is important for the assessment. There are a number of areas that you need to be competent at, and that will really determine how well you do in the assessment. When you come to do the assessment, depending on what skill you are doing, which you'll know on the day of the assessment, you'll be asked to do two systems assessments. So it may be that if you have a patient that needs oxygen, you might be asked to do a respiratory assessment and maybe a neurological assessment. So what I thought I'd do is demonstrate the skill via video so that you could watch it whenever you get some time, and hopefully that will help you prepare for the assessment. So when you come to do the assessment, what you'll be given is a patient chart, and you'll have some time before you come in to do the assessment to have a look through the chart, look at the patient's name, some of the details that are in the chart that will relate to what skill you are doing. So for now, I'm going to demonstrate how to put up an IV therapy. So I've been given a chart with George Miller's name on it, and inside you'll find some clinical notes, a use score and medication chart, and anything that's relevant to the patient. I'm not going to show you the details of this chart because I don't want you to get hung up on, having an exact assessment with this patient. You'll have a different patient in a different set of circumstances depending on the tutor that's assessing you. What I want you just to look at is the process of what I'm going to be doing and some of the things that you need to know for putting up an IV. Hopefully it'll give you an idea of how to do the assessment and what things you need to be considering. So for this chart, for this patient George, I'm going to be putting up some IV fluids. Okay, so what I know about George is that he's a 45-year-old man that's come into the ED after a 2-day history of diarrhea and vomiting, which they think he became unwell after some food, so potentially food poisoning. So what I've been asked to do is do an assessment of his cardiovascular system and his neurovascular system. I'm also going to be putting up the IV fluids. Okay, so I've just come into the room after washing my hands at the basin, and I've entered the room with my patient's chart, and I'm going to do a few checks before I start the assessment. As I'm walking into the room, I'm noticing a whole lot of different things that become my primary assessment. So that is your A, B, C, D, E, which I will do. But I want to introduce myself to my patient, tell him who I am, and check his ID. Hi George, I'm Andrea. I'm your registered nurse that's looking after you today. I've just come in to do a quick assessment and then put some IV fluids up, which the doctor has asked me to do. If you can just confirm to me what your name is. So I'll look at his ID card, his ID band and match it up with the chart and his date of birth and his NHI number. So that's correct. I'm just going to pop his chart down because the next thing I want to do is do an A, B, C, D, E assessment. So the first thing I do when I come into the room is look around and see how my patient is in the bed. So I notice that he's slightly inclined. When I look at him and he's talking back to me, I know that he has an airway. I can see that my next assessment is going to be breathing, that his chest is rising and falling, and that he's talking to me in normal sentences. So I'm not concerned about his respiratory system. The next thing I want to do is, once those two things are established and I have no concerns with his airway, is do a set of vital signs. So that's what I'm going to do next. So, George, if it's okay with you, I'm just going to check your blood pressure. So while I put that cuff on, even though I'm not concerned about his respiratory system, it's an assessment that I can make with the O2 SATS monitor. I can put that on at the same time. I'll just pop your arm up there and pop the O2 SATS monitor on. At this point in the assessment, you are probably wondering why I'm using a mannequin and I won't be able to get his blood pressure or his pulse in actually what they are. So when you're working with your tutor, you will ask her for what the results are. So now that I've checked the blood pressure, I can ask the tutor what was his blood pressure. So she's going to tell me that it's 100/50. So I need to check his pulse, and I would say to the tutor, I just want to check his pulse. And she would tell me that the pulse rate is 92. When I check the O2 SATS monitor, it says 99%. The other assessment I'm going to do is his temperature. So I'd get a temperature probe and check his temperature. And I'd also count his respiratory rate. So I'd ask the tutor what the results of those were. So in your assessment, you will all be using a static mannequin. This one, although he can be activated, won't be activated for the assessment, so that everyone is doing their same assessment. So I'm watching the rise and fall in his chest, and I asked the tutor for what his respiratory rate is, and she's going to tell me it's 12 per minute. So with that information, I can now establish that his airway is intact because he's been able to talk back to me, that his breathing is within normal limits. His O2 SATs are 99% on room air. His blood pressure is 100/50. Okay, his blood pressure is 100/50, and I know that his pulse is 92 and his temperature is 37 degrees. So I have an idea of his stability at the moment. I'm quite happy that he is safe in the bed, and I can see that he has an IV cannula in situ. One of the assessments I'll also make is his VIP score. So I'll just pop round and have a look at that. I need to know that his IV is able to be used, so I'd ask the tutor when the cannula was put in. So she'll tell me that it's just gone in and it has been flushed, so that it should be ready to be connected. So when I'm looking at the site, I'm looking for any redness, pain, swelling, or irritation, or he might say to me that it's really sore. My assessment at this point is that it has none of those things, so his VIP score is 0. So I'm happy to carry on and put the IV fluid up. For this assessment, I was asked to do a cardiovascular assessment and a neurovascular assessment. So I might do those, I've done part of them, but I might finish those after I've put the IV fluid up. The reason I'm going to do that is because he's come into the ED for treatment and he needs the IV fluids, so I think it's a good idea to get those started because I feel he's quite safe at the moment, and he needs the IV fluids. So I'm going to go and collect those. Before I go away from the room, I'm going to make sure that he has a bell, so if he needs to, he can call me back at any point. I'm going to make sure that he's safe in the bed, so he's at no risk of getting up. At the moment, I'm not concerned that he's confused or anything like that, so I'm quite happy just to say to him that I'll be back shortly with this IV, and if he needs me, he can call me through the nurse call bell. So let's go and do that. Okay, so when I went away to get my equipment for this procedure, I washed my hands with gel. Remember that you can do that in between going to the hand basin to do a complete wash, but because I've walked away from my patient, I used the hand gel prior to setting up my trolley. When I got to grab my trolley, I gave it a complete wash from top to bottom before I put all my gear on there. And now that I've come back to the patient, I'm again going to wash my hands, because I'm going to set this IV up at the bedside, because I've got the IV pole here and it's a little bit easier. So I've come back into the room, acknowledged my patient again, and I've just let him know that I'm going to go ahead and set the IV up. So I've got my patient record, which has the IV instructions in it. So you'll need to work this out when you get your orders, but for this patient he's having a litre of normal saline over 8 hours. So I've worked that out to be 125 mils per hour, which is what I'm going to put up. So again, I'm going to check my patient's details, so the medication chart with his name band, and I'm going to confirm to him that it is George and that he has the right date of birth and the right NHI number prior to me setting this IV fluid up. Remember, when you do this, you'll need to be checking it with your RN. So the tutor that's assessing you on the day will be that person for you. She will check, or he will check the IV solution for you and do the double signing. So what I've got here is some normal saline. I've got some tubing that I'm going to connect to the bag so that I can connect it to my patient. I've got an IV label to put onto the tubing so that the next person knows how long that tubing's been hanging up there for. And I've got an intravenous therapy label which I'm going to fill out with my patient's details and all the information that you need prior to putting the bag up. So I know that my patient needs a litre of IV saline, so that's what I've got here. So I'm going to, firstly when I get the bag, look at it to make sure that it's complete. That sometimes when you get an IV bag that has a little bit of condensation in the bag, that's a good thing. So it means to me that the bag is quite fresh, and so I'd always check that prior to putting it up. I'm going to discard that down there. When I get my bag of saline, I'm going to check what it is. So this is 0.9% of sodium chloride, which I know is normal saline. I know that it's 1,000 mils, and I know that it's in date. So this one says December 15, so it expires at the end of the year. I'm also going to give it a wee squeeze just to make sure there's no holes or the plastic hasn't been deteriorating at all, and I'm going to look into the bag and make sure there's no sediment or anything floating around in there. So I'm quite happy that this bag is safe to give. The next thing I need is the appropriate tubing. So this is the ClearLink system, and I know that's appropriate because firstly it's in date, and then it's going to connect up to the interlink system that my patient has, so I know that that's the right tubing. It also tells me that it's a 20 drop per ml drip factor, so we'll need to work out what that is, because what I want you to do on the day is demonstrate how you would regulate the drip rate also prior to connecting it through the machine, so you need to know how to do that as well. Alright, so I'm just going to give my hands a quick wash again because I've been touching that packaging, and I just want to make sure that they're nice and clean before I start. So I'm going to hang it up on the IV pole here. I'm going to open up my tubing. Now these have like a serration. Okay, so I've got my IV and my IV tubing, which I've taken out of its plastic case, and I just want to make sure that my tubing is all intact. So I'm going to unravel it, being really careful not to touch it onto anything. So making sure we've got a good hold of it, and then making sure I turn the roller clamp off, because the last thing I want to do is connect it to the bag and have all the fluid just come out the other end. So the way I'm going to do that is, these have a plastic spike cover. I'm going to take that off, and I'm going to take this plastic cover off and then connect it to the bag. Okay, so at this point, because the roller clamp is turned off, the fluid isn't going to go anywhere. So now I can have a good hold of the tubing to make sure that I'm not going to drip it anywhere. First thing I'm going to do is squeeze this little chamber here to about halfway, and then I'm going to let the fluid come down through the tube. So I'm just going to get the roller clamp and just release it really gently, and I'm going to observe the fluid coming down the line, because when it gets to this intersection here, I want to make sure there's no air in there, because that's used as an injection port. So I want to make sure that when it gets down to this area, I'm going to flick it so that the air is released from there. I'm just watching it come down slowly. I can be a bit quicker now that I know I've got a good hold of the tube. Okay, so it's about there, so I'm going to slow it down a wee bit. And as it comes up past there, I'm just going to flick it so that the fluid goes into that connection and starts coming up the tube. When it gets to the end, I'm just going to turn it off. Okay, so I haven't dropped any out of the end, and I can see that through my tubing, once I check through it, that there's no air bubbles in there, because it's really important that your tubing is clear of air. So I'm just going to connect that up there for a minute. This is the connection. You don't want to take that off, because underneath that is sterile, and you want that to be completely sterile when you connect it to your tubing. Okay, the next thing that you want to make sure you've done is fill in the appropriate documentation. So putting the date and the time that you've signed that you're putting this tubing up. Oops. So what I do is just pop that up about there, so that I know that tubing is when that's gone up, and that I've filled in the correct information on here, and that's going up on the bag. It also needs to be checked by your RN, so make sure that they sign that with you. I'm doing this on my own today, so I haven't got a second checker, but I would always get that checked. I'm going to pop that up on the bag. Okay, so the next thing that you want to do is make sure that your IV is accessible, and that you scrub the hub, which is what you really need to do prior to putting anything through the IV. So I've got the hub of the interlink, and I'm going to give that a really good scrub. Making sure that you take at least 15 seconds to do this. And it's a really good scrub. And then you're going to let it dry. Okay, so I'm just going to pop that down so it doesn't touch anything, because I've got that nice and clean now. And for the purposes of your assessment, when you come to connect, the first thing you're going to do is do a manual check of your IV. So now that I've got that ready to go, I'm just making sure that the clamp is off, and then I'm going to connect this up without touching anything. Okay. So what I want to do firstly is do a manual check. So I'm going to make sure that I haven't connected it through the IV pump yet. So I'm going to make sure that everything's open. So all my clamps are off. And the clamp down here is off. And then I'm going to use the roller clamp to count the drip rate. So what you need to bring along is your fob watch and make sure that you've calculated the rate that you want to deliver over a minute, so drops per minute, and then you're going to do a manual. So while you're doing that, you'll be adjusting the roller clamp and counting at the same time. So make sure you do that for about a minute. Once you've done that, then you need to connect it through the machine. So I'm just going to turn those off and make sure that this clamp is off, and then I'm going to connect it to the pump. So in the first instance you push the on button, and then it's going to make a loud noise, and what it's telling you there is that it wants you to check the speaker. So you've got to do a speaker test, and then it's going to say, did you hear that? And you go yes, and then it's going to give you new patient. I'm going to push new patient, and it tells me that the memory has been cleared. So I know that the information I'm going to put in now is the current for my patient. So I press done. What I then need to do is I've calculated 125 mils per hour, so I'm going to put in the rate, which is 125, the volume, which is 1000, and then I'm going to press open. And I'm going to connect my tubing into the machine. Okay. It's then going to ask me to confirm primary, which I'm going to do, and it's ready to start when I'm ready. So the last checks I'm going to do are that I've got the right bag hanging and it's all labelled correctly, and that I've connected it to my patient. So what I need to do is make sure that all the clamps are undone. So I'm going to undo this roller clamp and this clamp here that goes directly into the IV, and then I'm going to confirm with my RN that she's happy for me to proceed, and if she's happy that I've put the right medication, the right time, the right patient, the right route, and right, I've forgotten the other one, but you know what I mean, I'm going to press start. Okay, so that's going to start that IV. I'll just pause that now and turn that off. Okay, I just want to give you a really good look at the IV itself and what you need to do to connect it up to the IV. So you're looking at the IV that has a dressing over top of it, and it has this extension tubing which has an interlink end on it. This is a clamp that will stop it leaking while it's got nothing attached to it. So when you're connecting your IV tubing, you need to scrub the hub. So you get your alcohol wipe, and it's this part here that you want to give a really good scrub. So making sure that you spend at least 15 seconds doing that, and putting a bit of friction on there. So don't be gentle about this, make sure you give it a really good scrub. Okay, now I'm going to let that dry. And I don't want it to touch anything, so I'm really careful about where I put it down. And then this is the end of my tubing, and this is a cap that's keeping everything sterile underneath, so that is what I want to connect to this tubing. When you take this blue cap off, you'll find that it has a male end on it, so that bit that's sticking out, with a lure lock cap here, and that is what will secure it to the interlink connection there. So you pick it up without touching it. That has a plastic valve in it, and that just simply connects by pushing it in, bringing that collar down and turning it around. See how that's connected? So now I've done that, I can start my IV going. Remember that when you go to start your IV, you're going to need to undo all the things that are going to stop the flow. So this would be one, so undo that one. When you connect it to the machine, you're going to want to undo that roller clamp all the way. So it's connected to my machine now, so I'm going to undo that one. If you have any issues with an IV stopping or kinking, just make sure that you start from the top and make sure you go all the way down, follow the line down, so that you can find out where the occlusion might be. It generally is just something simple like right here. Okay, the next thing I'm going to do is tidy up my equipment. So everything that I've just used that I can take away from the bed, I'm going to take back to the area over there and dispose of the rubbish. Make sure that I've washed down my trolley and stored everything that I didn't use, and make sure that I've washed my hands. So I would at that point wash my hands at the basin. I'm then going to come back and assess how my patient's going. So I'm coming back into the room, I'm going to use the hand rub, because there are still a couple of assessments that I need to do. So my IV is running at the moment, so I'm quite happy with that. And I've been asked to do a cardiovascular assessment and a neurovascular assessment. So I'm going to start with the neurovascular assessment first. So in this situation, in this context, I'm going to just run through the steps of it, and in the first instance do a Glasgow Coma Scale. So I would be assessing whether his eyes were open, what the verbal response was, and what the motor response was. So I can do that with a form. The other assessment I can do, which is the D of the A, B, C, D, E, is check whether he is responsive and alert, whether he's responsive to voice, whether he's responsive to pain, or whether he's unresponsive. And at this point, when I'm talking to him, he's responsive and alert, so I'd call him an A. I might then ask him some questions about where he is, if he can answer where he is and tell me what day of the week it is, who he is, and those kind of things, which in this situation should be quite an easy thing to do. To carry on with my neurovascular assessment, I'm going to be looking into his eyes and making sure that his pupils are equal and that they're reactive. So I'd then have a wee torch and I'd have a look to check for his eyes and see whether his pupils are reactive. The next thing around his speech is just to determine if he's speaking normally, so that the normal rate and volume, and that I can understand what he's saying. The next thing after that would be to check the strength in his limbs. So I'd ask him to hold my hands and squeeze them, and if he can do that, that's great. And then I'd move down to his feet and ask him if he could feel me touching his feet and get him to move his feet up and down for me. To check his memory, I might ask him how it was that he came in and the circumstances around that. And if I needed to, at this stage, I don't think I need to do anything further in terms of a neurovascular assessment. I certainly don't think he needs a mini mental state, and I'm finding that he's responsive to me, so I feel quite comfortable that his neurostatus is intact. The next thing I was asked to do was to do a cardiovascular assessment. So I have some of that information. I have his blood pressure, his pulse, and a couple of those things. I just need a bit more information. So what I'm going to do is look in the first instance at his colour and make sure that he's pink. I'll put my hand on him to make sure that he's warm, and check that he's well perfused. One of the ways you can do that is by looking and doing capillary refill, which I would check on his fingers. So I might just, so I've checked that. I'll then ask the tutor if they thought that what his cap refill time was, and hopefully it's less than 3. So she's going to tell me that it's 2. So I'm happy with that. The next thing I want to do, I may check his blood pressure again. It might be appropriate in this case to do that because we've started some IV fluids, and I'm hoping that his blood pressure is a little bit better. If I said to my tutor I would recheck his blood pressure, they would give me a new set of signs, vital signs. So she might say it's now 110/60. In my mind I'd think, well, that's great, it's come up a little bit. I'd also want to check what his pulse was, and I would do that and ask my tutor what his pulse rate was, and she might say that it's now 80. So that's more within the normal range for a 45-year-old male, so I'd be quite happy with that. Remember to describe when you're doing pulse, the rate, rhythm and depth, so make sure that you let your tutor know, or you can ask to make that assessment. The next thing I do is just have a quick look. In his history, it doesn't tell me that he has any cardiovascular issues, but in terms of assessment, I'd want to look at his pedal pulses as well. So I might go down, check to make sure there's no edema or anything in his feet, and check his pedal pulses. The tutor would then tell me that she was happy with his pedal pulses and that they were normal strength and normal regularity, so I'll be quite happy with that. Another assessment I might make as part of a cardiovascular assessment is to ask whether they have any chest pain. And in this situation, it doesn't fit why he's come in, so my tutor might just say no, he doesn't have any chest pain, but that is part of the assessment that I'm making. I might then say to the tutor, as part of a cardiovascular assessment, I would then do an ECG, and that would sort of form part of my assessment. So at this point I have completed the assessment that I've been asked to do, so I would then start to formulate in my mind what my handover was going to be to the tutor. Okay, at this part of the assessment that you've been going through, your tutor is going to want to have a handover of exactly what happened throughout that assessment. It's quite helpful when you go through the assessment to write things down, so make sure that you bring a little book if you want to write down what the observations are, and any assessment data that you think you might forget. That will be helpful for you when you come to hand your patient back over to the RN that's assessing you. So in this situation, I would start off with a little bit of history. So George is a 45-year-old man that came in through the ED, and he was seen by the medical staff who thought he needed some IV fluids because he was dehydrated after having 2 days of vomiting and diarrhea. So the skill that I was asked to do was put up some IV fluids. Remember that your tutor is going to be assessing you on the domains of competency that are determined in the rubric. So remember, throughout the assessment, she's going to be looking at things like your therapeutic communication, how you do your assessment that you've been asked to do in the 2 systems that you were given. She's going to be watching at all times that you are doing hand washing at appropriate times. So remember to the 5 moments of hand hygiene, because those are really important and they're going to be noted. She's also going to look at the equipment that you gather, how you do the clinical skill, and how you dispose of the equipment that you don't need, and that should be the easiest part of the actual assessment, I think. The documentation will, in this instance, be around the labels that you're putting onto the bag, that you're making sure that you're doing the 5 rights of medication administration, and that you're having someone check within the boundaries of what you can do as a student nurse. So make sure that you always have your RN checking before you're starting anything. Make sure that you you don't have to write in the medical notes, but you need to give a verbal handover of your patient. So to continue with the verbal, you might go through the ABCDE assessment that you did and talk about some of the assessment data that you picked up and just your overall sort of assessment of what that data means. So I would talk about his blood pressure being a little bit low when he came in prior to starting the IV therapy, and that it had slowly improved as we'd given him some IV fluids. I'd also talk about, in this context, using a fluid balance chart, because we need to put the IV fluids onto a chart, and then I'd talk about urine output. And that would be sort of the next question that I'd lead on to, would be asking whether he needed to go to the toilet and pass some urine, and then I'd measure that and put that onto the chart. At this point, your tutor is just hoping that you've completed the actual skill assessment and given back some data, and that you've done it in a safe manner. So if you have any questions about this particular skill, please email me, and we'll talk about this as we go into the preclinical weeks, and hopefully you'll get lots of practice to do this skill.